I think we frequently speak the language of healthcare, but sometimes we really need to speak the language of equity or housing or food justice to make sure that we're meeting the community where they're at and other players that are all moving towards the same effort, and make sure that we're speaking the same language and working towards the same goals.
I think often there's a deference to the healthcare entity that because they're either the ones who have the money or the credentials or the power, and the ones with oftentimes the limited time, there's a deference to that when that isn't always appropriate. And so I think when you're involving a healthcare entity as a group, maybe a hospital network, or you're involving individual providers in the provider level, really spending the time to think, what is it that you are bringing to the table specifically, as opposed to just this sort of deference to the larger entity, or again, that necessity to be a key player all the time. My guidance and advice to healthcare entities who seek to be strong partners is for them to be deferential to the other groups and figure out where they need to fit in, not to take over or to squash.
Our healthcare institutions carry a lot of weight, and they're often connected to academic institutions. And, a name like Jefferson, a name like Temple has a lot of respect in the community. So just sort of having their name attached to a project like this is key. And, when it comes to funding or other requests, or sort of shopping this work around for other partners and other, funding opportunities in particular, it's been incredibly valuable to have a name like that attached to the works. Depending on the institution and their priorities and their CHNAs and where they're aligning their resources, there could also be resources coming from the health network, and time, people power as well, to dedicate to the work, rather than just saying, oh yeah, we care about that, let us know how it's going. Fully investing because it's one of their priorities. So yeah, I would say name and financial resources are huge.
The advice that I would give is not to assume that you or your organization is the big draw. I think we've assumed that people would come to our table because we're the healthcare organization. But we've spent some time trying to map out who were the stakeholders that represented these different social determinants of health, so we could get them on board with us.